I'm Dr. Lucas Macmillan. I focus on sports medicine, chronic pain. I started off in a Bachelor of Science program where I got exposure basically to academia. I had the original goal of going in to become a medical doctor, but I wasn't loving the program. The sciences weren't as exciting as I was hoping. I didn't get a chance to deal with people and to help people. So I went into the Bachelor of Science in Nursing. So that's where I became a registered nurse, got a chance to see the hospitals, go into the community settings. It was great. Had a chance to care for people and get those exposures. Ended up in the hospitals and community settings, so I had a chance to get out of the hospital and see that as well. I absolutely loved it, and I had another turning point. I wasn't sure if I wanted to stay in the hospital and actually live in the buzz with so many patients. I mean, we're doing great things, but it's not where I belong. So I found naturopathic medicine. It's a 4-year program, and through that I had a chance to sit down with patients. I could spend time just with one person, really get to know them and what's going on, and do amazing things from that. If you can take the time to figure out what caused what is happening with them and how their journey has been so far, you can put the pieces together and give them a solution. You can actually take them to the next step. So it's part of what brought me here today. Common things that we see would be arthritis. So eventually the joints break down, especially after you've had an injury. So in soccer, in combat martial arts, many other things, you get torque and trauma to the knee that actually causes a breakdown of the ligaments. So especially ACLs, MCLs, you see meniscus damage. Eventually that causes a breakdown in the joint as well. So as things start to degrade, you get pain. I see a lot of tendonitis. Similar sports, rock climbing, I mean, basically anything you do, most sports have a similar repetitive component that causes a breakdown of tissue. That breakdown eventually leads to soreness and inflammation that just doesn't go away. It keeps coming back, keeps flaring. After it's gone on for so long, the inflammation starts to go away, and it's just basically a painful process. I see tendonitis, which is a gradual breakdown of tissue that happens because we're repetitively using the same muscles or muscle groups. We're not giving ourselves enough rest or enough nutrition to actually build those back up. All of the sports movements that we do actually break down tissue. And that's a good thing. We want to break down tissue so that it can grow back and then grow back stronger. But if we're not giving ourselves the time and the resource to actually build things back up, we're going to see a gradual breakdown. We're going to actually be worse the next day than we were the day before. We're not building, we're not giving ourselves that time to grow. So to treat that, we're going to be looking at nutrition, we're going to be looking at how the person is actually functioning and how they're moving. If they're excessively breaking down their body by improper biomechanics and by using improper movement patterns, they're going to have more problems, and it's going to be hard to treat that just by nutrition or just by painkillers. So depending on where they're at, we might look at acupuncture, we might look at some botanical medicine supplements that kind of bolster their nutrition. Obviously we're going to focus on diet and be sure they're getting the basics there. From there we can get into the fancier therapies. We can get into some injection therapies to help to regenerate some of the ligamentous tissues. We can offer some adjustments and joint mobilizations to be sure things are moving appropriately. And it changes person to person depending on what they need. That's what we try to offer. If we can't offer it, we'll find somebody who can. Diet is very important, especially when you get into athletics and sports where you're causing more of a breakdown on your body tissues. Your requirements go up for many things. So one of the most common is protein. If you're not getting enough protein, you're not going to be able to keep building and actually keep increasing strength and increasing your ability to do your sport. Eventually, you're going to be breaking down to a point that you're decreasing. You're going to hit a plateau and then actually lose function. So we have to be sure that you're taking in protein. The different forms make a big difference. By far the most studied is whey protein, so it's commonly used. One of my new favorites is hydrolyzed beef protein. It's already pre-broken down. You're less likely to get the digestive upsets that a lot of people get from whey protein and some other forms. There's also, of course, vegetarian or vegan forms, and for some people those are right. A little bit less research into those, but they're also great for sports uses. Also, if you're not getting enough magnesium, magnesium is one of the things that helps our body to relax and slow down. Exercise makes us tight. If we're not stretching, if we're not actually getting those releases and slowing down, especially with overtraining, things start to tense up. Magnesium is one of the things that can help to loosen you off. Vitamin C is also used quite a bit for regenerating tissues. So if you're in a combat sport and you get those strikes, vitamin C is one of the big things you're going to burn through, because vitamin C helps to regenerate all sorts of tissues, from basically your skin all the way right down to your muscles and tendons. That's going to be used in the regeneration of all of that. So depending on where the patient's at, we go through a dietary assessment. So if they are very active, I'm going to look at the diet a little bit differently than if they're somebody who spends most of their time in an office staring at a computer. Their requirements are going to be quite different. Because the requirements are different, we have to treat differently. So I'll be looking at what's already going into their body through their diet, make some adjustments or some recommendations to make their transition a lot easier to include the nutrients that their body needs to keep building and keep growing. And anything that we can't hit specifically just with the diet, we'll throw into some supplements. So there's B vitamins, there's vitamin C, there's protein powders, there's creatine. Depending on what our goals are, you can really bolster the results by adding these things. We offer professional line supplements. That's a bit different than what people order off of Google or find from their health food stores because the professional brands are accountable to us. My job as a clinician is to ask them questions and be sure that they're actually giving the right products. I want to see third-party testing. I want to see some sort of verification that what they claim is in the bottle is actually in the bottle. There's some great studies that show, if you look into creatine, if you look into DHEA, certain proteins, all over the place, they're advertising that there's a certain amount of these products in them, but when you actually test that, it's all over the place. All the way from 0% of the active ingredient, which is atrocious, all the way up to 350% for some of them, which means they're not really paying attention. They're throwing some bulk ingredients, hoping the right percentages come out. Sometimes you get nothing. Sometimes you're getting too much, might even be unsafe for some things. You won't get that here. You're guaranteed to be getting what is said in the bottle, in the amounts that are said, and you don't have the fillers. A lot of time the non-medicinal ingredients are the scary parts. I mean, we're adding in fillers and we're adding in binders, we're adding in things that aren't useful for you. They just basically allow the processing plant to make more of these supplements for cheaper and quicker. Some of the ingredients, for example, will just help the machinery run faster. It's not a benefit to you as a human being. It's literally something that prevents it from sticking in the machinery itself. Why that's a problem, when that goes into your body, it might be doing something that's not great for your digestion, it might not be helping your absorption. It's not really well understood, and it's not a healthy idea to be putting in things that we don't need in our body like that. We offer supplements and products from professional brands that are suited toward you and what you need. So if you had access to the same basic arrangement of supplements, I wouldn't recommend just going and taking everything. That's never a good idea. It might not be helpful for you, it might actually be harmful for you, and it might take you further away from the goals that you want to achieve. The supplements are supplemental to your diet in a way that we're taking it to build you to the next level towards something. If we don't set our target and we don't take supplements appropriate for that, we could be pushing ourselves in a completely wrong direction, and sometimes it's even harmful. So we go through your diet, we get to know where you're at and see where you're deficient in. So for example, if you have that tendinitis example, we might be giving you more protein if that's something you're deficient in. If it's something you're already getting too much in, it's not necessarily helping you. And protein can actually turn into fat. It can take away from that big look that a lot of people are going for. So as a simple example, that's one of the things we can cause. Similarly, something like magnesium. I love magnesium, but I don't prescribe it for everybody. Magnesium itself can actually lower blood pressure. If you take too much of it, it can cause diarrhea. It has different effects on different people, and if you already have low blood pressure, if you already have problems with loose stool, for example, it's not something I'm likely to give you because it'll probably make those things worse. If you're not aware of these types of interactions, or better yet, how they interact with drugs or sometimes other supplements, you might be wasting your money and you might be causing yourself less of a benefit or even a harm. There's great information available, but until you get an understanding on how to put that together. So we start off getting to know where you're at nutritionally, we see what your needs are with whatever your sport is or whatever your goals are, and then we're going to offer you products that will suit those needs, will fill in the gaps, help to move you forward. If we just basically gave you everything and offered the same thing to everybody, we wouldn't be getting the same results. We're results oriented. It's very important to us to actually move you forward instead of just offering you things that are not going to be of any benefit. Far infrared sauna is great, has many benefits. So it can help to decrease blood pressure, it can help to detoxify and basically sweat everything out of your body. It's a good chance for us to get all of those things out. We're going to have exposures through every day. We're breathing it in. We have car exhaust fumes. Many of us have mechanical jobs or things where we're exposed to those oils or things that absorb into our skin. It causes problems over time, and you can gradually get that out by going into a sauna. It's also a time for people to relax. It's something we don't have enough of in our daily lives, just to slow down. You don't bring in your phone, you don't bring in your computer, you just soak it in. You leave feeling completely different than you went in. You can offer it to people for that reason alone. This is your chance to turn off, get away from those kids that are slowing or driving you a little bit crazy, or the stresses of your job that you're having trouble escaping because your phone's always ringing. Just relax. You come out completely slowed down, you're in a much better space. I recommend it for that alone. Far infrared sauna is great. I recommend it to many people, generally in conjunction with other things, but it's a great way to detoxify. It's a great way to reset your body and reset your metabolism to help you move on to the next health goals. So it's more common with things like weight loss, more common as we're trying to relax and de-stress, more common with people that are living in a high stress environment or working long hours or don't have a chance to get away. It's amazing for that, but it can benefit basically anybody. As an athlete, your nutritional requirements are quite different. So you still need the same basic proteins, you need fiber, you need fat, but the ratios start to change because you're now replacing energy, you're replacing everything that's being broken down, and you're repairing a lot of tissues. So that's going to burn through your resources in a different way. So protein requirements do go up, your vitamin C requirements do go up. Basic B vitamins, you're burning through those as you replenish your stores. Different sports require very different nutritional intakes. So highly aerobic sports, the long distance runners and the ultra marathon type people are going to have different requirements than somebody whose goal is to maximize their strength, who wants to lift more, who wants to bench press more, or somebody like wrestling. Say wrestling is very strength based. You obviously have to stay agile as well, but it's very important to keep that lean mass up and be able to push through, have the strength and the power to actually defeat your opponent. That's going to change the nutrients that your body needs to actually get there. So it's going to change the amount of protein that you need, it's going to change the amount of B vitamins, the amount of magnesium that's going to be beneficial for your body, and there's different ways to actually get that to you. So we'd start off looking at the diet, at what you're actually getting in through your foods, see what we can add in through some supplements. We can even go IV nutrition, especially say long distance runners and those who train very hard. Their digestive systems tend to get a little bit left behind. They start to have digestive problems. It's pretty common to have significant digestive problems when you get up into the higher level of running. IV nutrients can be a way to get around that. Although you're still eating good food, you're still doing what you can to get into your body this way, we can boost and really maximize your results by actually putting it directly into your body. We're bypassing that faulty digestive system, in some cases giving it that little bit of a break while it restores and rebuilds. It can get you to the next step in your sport, It can help you to actually keep building and keep growing in your sport, and can help to decrease some of those digestive upsets. So it's important that we offer supplements and foods that aren't going to make those things worse. Certain types of fibers can actually take you away from your goals, can actually add to that diarrhea or add to that other chronic problem that you're having. We have ways to get around that. So IVs are great. Targeted supplements and nutrition can actually skirt some of these issues while giving you the nutrition you need to get to the next level. When patients come to see me, my goals are to make their transition to what their goals are as easy as possible. I want to help them reach their goals with as little problem and as little barrier as they can in the most effective way possible. So we'll offer nutrition, we'll offer dietary advice, supplements. In some cases we'll offer adjustments, we can offer targeted injections, we can offer IV therapies, we can offer acupuncture. There's a wide range of tools that we can basically add to support and bolster their efforts. Many people work hard and in their heart they want it so badly, they're pushing hard for their goals, but they're not doing it in as efficient or sometimes as appropriate method as they can, and they're pushing themselves away from their own goals. My job is to educate, allow them to help themselves, and to offer many tools, bits and pieces that will make their job much easier and help them get to the next level. I want to take them to where they want to go and beyond, and as simply, as efficiently, and as easily as is possible. It's very common for people to hit a plateau. They feel like they're getting the benefits they want, and then they just basically hit a wall. There's this unseen force or ceiling that's preventing them from progressing to the next level. Those are the points that we can really help to break through. We can help to maximize their gains, push through, identify exactly what that barrier is, and find a way to work around it. Chronic pain is complex. It can be coming from many different sides. The first job is to identify what's going on. It sounds easy, sometimes it takes a little bit of work. So I employ different tests, I go through physical exams, I ask a lot of questions. I want to gather as much info as I can, because if we have a goal, we really have to define what our target is if we're going to hit that target. If I don't know where you are and what your problem is specifically, it's going to be really hard for me to help get you out of that problem and into a place that you want to be. So step one is an intake. We go through a lot of information, a lot of questions, but it's all very useful and it's all very directed at what the problem is and how your body is functioning. The problem might not be related to that joint that hurts or to that digestive problem. It might be something else in your body, and it's important to actually figure that out so that we can take you to the next level. Once we have the info as to exactly what the problem is and where we want to focus, then we start the treatments. Then we dive into, okay, this is going to most efficiently get you past that problem, and this is going to help you get that level of growth or benefit that you're after. This might help you sleep better, this might help you better build muscle, this might help you to digest or actually absorb your food better, which is going to help you to feel more energetic, help you to feel stronger, help you to feel more motivated. One interesting thing that I've seen with some patients, they come in and they feel like, I don't really have the energy, I don't want to make much changes, but I want to feel better. We offer some small adjustments along the way, and they start to feel better, they get more motivated, and things get easier. Now they have more energy to actually go for a walk once in a while. They have the ability to push after their own goals and achieve what they want, just because we've taken small steps that has made it easier and easier as we've gone along. Patients come in and they've had pain for many years or many months, a lot longer than they need to have that in their lives. It's okay to be hurt and to take some time to recover, and that's normal. It's a part of life. When things go on for longer and we get used to it, it becomes part of our normal lives, there's a problem. This doesn't have to be that way. There's answers to actually get us to the next step. So for example, if we're not actually absorbing our nutrients and our body therefore isn't able to regenerate and repair the way it needs to be, IV nutrition can be one of the things that can help to push us through that. We can put amino acids directly into the blood, we can put B vitamins, vitamin C, many other things actually into the body directly, bypassing that faulty digestive system to actually get you to the next level. We're going to be using that in conjunction with other treatments. It's never going to be just one single therapy here, but we're going to offer things that aren't easily accessible otherwise. With chronic pain or really any sort of injury or pain itself, we can use a diagnostic ultrasound to get a better visualization of how the tissues are performing and looking actually under the skin. Because we can perform a physical exam and get a general idea, we can actually visualize with these. So if I'm having trouble actually differentiating between what is damaged in the shoulder, it's a fairly complex joint. You can't just go through a simple physical exam and get all of the information. We can visualize and see where the swelling is and what's actually causing the problem. It really adds to the diagnostic abilities and improves our ability to diagnose the problem and create a specific treatment to target that problem. Prolotherapy is a type of injection therapy where you're basically causing the body to release growth factors to regenerate an area. So where you might use this, if you have knee osteoarthritis or if you have torn ligaments or meniscus, you can actually inject in some of the connective points or actually into the joint itself to cause regeneration. So it helps to rebuild some of these tissues, helps to tighten them back up. The growth of tissue actually tightens down and it causes a decrease in mobility. Many times with arthritis, you have excess mobility in the joint and that causes a problem. If you have surfaces that are meant to contact each other, it's generally not painful. With that increase in motion, or if you have a loading on one side of the joint, that causes excess breakdown and that causes pain. If you tighten that joint back up, you can actually decrease the amount of movement and decrease the amount of pressure and pain that causes from that part of the joint. So you get results by regenerating the joint and by actually decreasing further damage. Platelet-rich plasma is one of the therapies we offer. It's also known as PRP. Platelet-rich plasma is basically an extraction of a person's own blood. It's centrifuged down, so it's spun off to separate the different blood components. The platelet-rich component is extracted out. We go after that because that's where the platelets and the growth factors live. Growth factors cause the regeneration of tissue and causes a healing cascade in your body that would normally be there, but often is slowed down, or there's some sort of barrier to that in chronic pain or in sports injuries. If something's been there for a long time, these growth factors generally would help to regrow that. We can concentrate them, put them right into the area that is damaged or that isn't regenerating appropriately, and basically supercharge that process. We can get that healing process to the next level, and we can remind the body there's a problem right here. There's a call to arms right in that area with the injection of the growth factors, and decreases the amount of pain and the longevity of injuries. In some cases, it can actually help to prevent injuries further down the road, but it depends on how we're actually using it. So again, can be used for arthritis, can be used for soft tissue injuries, more common in tendonitis, like tennis elbow. It's actually amazing for tennis elbow. There's good research now on plantar fasciitis, just many of the common pain sources that people have. You can actually fix some of these things just simply with the injection therapies, and I believe even more so when you pair it with nutritional and pair it with the variety of tools that we can offer to personalize it where you're at, what your body needs, and fill in all the holes in the regenerative process to make sure that these therapies actually work for you. Ultrasound-guided injections are a unique way to actually add to these therapies. Prolotherapy and PRP are amazing by themselves. Much of the research has been done on non-ultrasound guided patients. I think we can take that to the next level by actually further identifying where the target areas are, looking at exactly what is damaged, what is swollen, where the actual liquid is building up, and inject those areas specifically. So what it's going to do is increase the efficiency and the accuracy of our treatments. It's going to bring people to the next level. So this machine allows us to actually see inside the joint, see exactly what is going on in the shoulder, in the elbow, in the wrist. We can assess how the tendons and how the ligaments are doing in the areas and then eject accordingly. Rather than going off of, well, it's vaguely sore in this area, or I think this is where the problem is. The problem is exactly right here and I can see it. I can watch the needle go directly into that area and I can be sure that I'm hitting the target that I want to hit. It's going to lead to better outcomes, it's going to lead to better results, and I believe it's going to lead to less pain. I know where that needle is going, it's going to be more comfortable for the patient. I feel it's important to understand the medications that the patients are on, to actually work with them. I don't have the right to actually take them off of medication unless I can prescribe them myself. I can prescribe them, I'm aware of how they work, I'm aware of what they interact with, and the benefits and dangers of both being on it and coming off of it. I feel that's very important to work with these things, because many people come in and they have prescription medications. It might be something that's good for them, it might not. It's important to have another set of eyes to actually look at these things. Also, for some of the sex hormones like testosterone, for estrogen, for progesterone, we can prescribe many of the bioidentical hormones. We can actually help to build people up to where they want to be that way if they need it. We always start with an assessment. We don't ever just throw hormones at somebody. It has to be appropriate, it has to be safe. But if it's something that they need, it can really help them to feel better. It can increase energy, it can increase libido if that's a problem. It can really help to bolster the quality of life of a person if they're imbalanced, to actually bring them to balance. Another thing we commonly see is thyroid. People feel like low energy, they're cold all the time, their digestion isn't quite moving, they're gaining weight, they can't get that weight off. We check for thyroid hormones. If their thyroid is out of whack, all of these things are going to slow down, they're not going to feel right. Sometimes it's debilitating, it gets so bad. We can offer thyroid hormone replacements. There's different ways to do it. There's hormones, there's synthetic and basically biological versions of the same things. We have access to a bunch of different things. I have a chat with the patients to see where they're at, what they'd actually prefer. We'll talk about the pros and cons, find out what's right for the person, and then get them to where they want to be. My name is Dr. Lucas Macmillan. I live in Port Moody. I live in the Klahani area. I love it here. There's millions of children and dogs. I actually have a child on the way myself. We are due early October, so pretty excited about that. I love the area because we can basically just walk along the inlet, go on up to Rocky Point Park. There's the Rocky Point ice cream that's quite good. There's many options in this area, basically all the way around the inlet. I love it here. I see a variety of patients. I often have male patients coming in for different concerns. I have seen different hormone fluctuations that cause problems both in their relationship and in their personal life. That can be quite distressing, so it's important to address some of these issues. So problems with energy, problems with weight gain or weight loss, or building muscle mass or losing muscle mass, problems with libido, problems with, especially as we age, it gets more common to have issues with urination, issues with intimacy and partner relations. It's pretty common to see people who specialize in women's health. It's all over the place, and it makes sense. There's a huge need for women's health. I think there's a huge need for men's health as well. It's just not yet being met. I think it's important to meet those needs. So it's one of the things I offer. I think it's important for men to take care of themselves and to have the odd checkup to actually be sure that things are functioning well, especially so if you already have symptoms. If you're at the point where there's issues, we need to improve those so that you can get on with your life, make things easy, improve your quality of life without putting restrictions on what you can do. So my job is to offer options and therapies to actually help decrease these symptoms so you can live your life free, happy, easy, not having to worry about these barriers to your quality of life. I think our culture of men, we expect ourselves to put up with whatever it is, whatever is ailing us, whatever's in our way. So whatever discomforts we're having, maybe that irritability that keeps building up, we're not sure where it's coming from. culturally, we often don't talk about these things. We don't get it out, or we don't look for a reason. We just expect that this is normal, this is the way it's going to be, and as a man, I need to deal with this. Of course, this is a huge generalization, but it's something that you see commonly. So there's causes for these things, and there's often solutions based on those causes. So step one, identify that there's something that we can improve in our life, something that we can maybe do without. Step two, get help to identify what that cause is. And step three, we can treat that cause. So if somebody comes to see me and they're having issues with irritability, issues with building or maintaining muscle mass, there's a reason for that. They might not actually be absorbing the food that they're getting in. They might be eating some foods that just aren't agreeing with their bodies and aren't actually nourishing them in the way their bodies need. It could be a hormonal imbalance. That's something that's very hard to assess yourself, and it's easy to feel like I'm that angry person, or I'm that person who has these types of issues, but I have to deal with it for the rest of my life. There's nothing I can do about it. That's not always true. Many times we find imbalances that can actually help to correct the path that you're on and make it much easier to get through it. You don't have to feel that way without finding any sort of answer. We shouldn't just expect that this is going to be our lives from here on. There's often answers, and I think there's a huge percentage of people that have these issues and have no idea that there's answers available. There are answers available for many of them. Sleep is a huge issue for men, women, basically everybody. I've seen a good number of patients that come in with sleep disturbances. It really takes away from how they feel, from how functional they are, and the motivation to actually change anything goes way down when you lose sleep. Sleep is a huge motivator, and when you take that away, we're tired. We don't feel like we want to actually do anything to make it better. So it's one of the big things we look at. Sleep, appetite. It fits into a large group of very important components. So specifically for sleep, we can offer some supplements or things to decrease the amount of time it takes you to fall asleep, the sleep latency, that time where you lay down until you fall asleep. We can target that. It's a little bit different if you have sleep maintenance problems. So if you can fall asleep but you're waking up in the middle of the night, there's different causes for that. Again, it can be hormonal, it can even be nutritional. It's pretty common to have a sugar drop in the middle of the night. If you eat certain foods right before bed, those can pull you out of sleep, wake you up in a cold sweat sometimes. There's ways to get out of that. Sometimes the fix is surprisingly easy. First, we need to identify the problem, then we can get to the next step of actually fixing it. I think integrative health is important. I think it's a huge benefit to the patient and a huge benefit to anybody seeking healthcare. I think that we can work together and actually come to a better outcome for the patient if we take bits and pieces from different specialties and different professional areas. So, working with the medical doctors, working with chiropractors, working with other allied healthcare professionals, I feel can only be to the patient's benefit. It's important that we team up. We all have different skill sets and different things that we can offer, and the patient will get the greatest benefit by getting the best of all of these worlds. I like to work with other people. It's important to me to actually be part of a system and to work alongside others, never against. I think that we're going to be helping people the most by actually building upon everybody's strengths and offering those things to the patient. I think integrated healthcare is one of the best things we can offer patients. I think that in using the training of various different professionals together to actually help somebody to reach their goal will only be of benefit. If we work together, we can get people further than if we're just doing these sole individual specialties trying to fix one thing at a time. The benefits of integrative medicine are to actually take the best of both worlds and put it together to make the best treatment plan for the patient. We're going to take bits and pieces from every different approach that we can possibly offer, find what fits where you're at, put it together into a program that is suited for you and your needs, and move forward with it. We're going to integrate from old therapies, from new research, from old tried, tested, and true ideas, put them together and offer you something that is going to be suited for you where you're at to actually move you forward and give you the best results possible. We don't want to be stuck with one possible option. We want to take little bits from everything that can work for you and put them together.